Week number 3, lecture number 3. Hello friends. In last lecture, we spoke about psychological aspects in palliative care. It was just a general introduction. Now we come to the subject proper, that is what is psychological distress, the factors responsible and the clinical features of psychological distress. We will also generally discuss, people say psychological distress and some people say mental distress. So, all these things we will just see what is psychological distress. Psychological distress is a state of emotional suffering, emotional, connected with your mind and not with your body, emotional suffering and associated with stressors and demands that are difficult to cope within daily life. You all know that life is not easy, life is not a happy journey as such. There are events which are very happy and there are many more events which are unhappy. So, it is a sort of thing which goes on, and when some of the times when demands from our life are so much that we are unable to cope up, and then our mind feels stressful, we can't do anything about it, and that is where that stressors produce tension, that is the mental tension, and that is how we produce psychological distress. It is basically that when we are unable to cope up with the demands of our life, of our society, of our job, of our children, of our family, and we feel helpless, so we start thinking like that and our mind gives the way, and that is how emotional distress takes place. Listen again, psychological distress is a state of emotional suffering associated with stressors and demands that are difficult to cope within our daily life. The lack of effective care for and difficulty in identifying psychological distress is frustrating for patients and health professionals alike. Some people refer it as psychological distress and some people refer it as mental distress. Mental distress is a term used by some mental health practitioners. I don't like this particular term mental distress, because in our society what we say mental is gone. When you say psychological, it is still good that he has got certain psychological emotional problems. But when you say he has got mental distress, so we just say he is a gone case, now can't be done anything about it, and he has to remain in mental hospital, mental asylum. He cannot come back to our own civilized society in his family. Mental distress is a term used by some mental health practitioners and users of mental health services to describe a range of symptoms and experiences of a person's interlife that are commonly held to be troubling, confusing or out of the ordinary. They call them mental because now to them he is unfit to remain with the family or in the society, and it is better to put him in a mental asylum, otherwise he will be a nuisance, he will create nuisance in the society. So, it is better to put him under lock and key. Mental distress can potentially lead to a change of behavior, affect a person's emotions in a negative way and affect their relationship with the people around them, and therefore we put the people who has got mental distress in mental asylum. We call it mental hospital. But the people, we have got so many people with psychological disorders, they go to a psychiatrist, get the treatment, otherwise also without the treatment also they lead a normal life. They are not volatile, they are not violent, and they will not create disrule in the society. Certain traumatic life experiences such as bereavement, stress, lack of sleep, use of drugs, alcohol, assault, abuse, accidents can induce mental distress. But such things like lack of sleep, of course, if it is continuous lack of sleep, yes, but if you don't sleep for a day or two or a week, doesn't put you in that psychological distress category. This may be something which revolves without further medical intervention, though people who endure such symptoms longer term are more likely to be diagnosed with mental illness. This is what I was telling you. Okay, such symptoms do come in our life also. We come under stress. Our wives, our children particularly, you see, they have to study a lot. They have to face so many exams, unit tests. They have to do well in competitive exams. So we all of us come under stress. But as and when the situation improves, it's all fine. We are happy again. So doesn't mean most of us have got psychological distress, temporary distress. And when the situation improves, again we are psychologically okay. So we don't require medication as such. But if this situation prolongs, when I say prolongs for months together, for years together, then yes, that particular stress can get converted into psychological distress. Some users of mental health service prefers to term mental distress in describing their experience as they feel it better captures the sense of unique and personal nature of their experience. This I agree with them, because generally they treat only mental distress. The people who are very violent cannot be tackled within the family background, so they need some special assistance, and special medications, specialists are available only in mental hospital, so we put them there in the mental hospital. What is psychological distress? Think of a time when you felt sadness. Maybe it was after losing a loved one or losing your job. You see, you feel sad many times. Even when you fail in the exam, you are sad. It happens. I just said, life is a roller coaster. Sometimes you are up and sometimes you are down. How did you respond to the situation? While some people may have no difficulty dealing with these events, they may trigger unpleasant feelings that make it impossible to cope and carry on with normal activities in others. For those of us who experience these unpleasant feelings and have difficulty coping, we are experiencing psychological distress. It's a general term used to describe unpleasant feelings or emotions. One should not worry if such things happen. If prolongs, then I suggest meet some psychologist and he will give you ways and means. Psychological distress is a subjective experience. That is, the severity of psychological distress is dependent on the situation and how we perceive it. I also undergone so many psychological things, but I just take it. Even to me, giving so many lectures here in few days' time, it is also psychological distress to speak continuously. But then we have taken it, we have taken the task. So we feel, of course, some sort of psychological distress, but it's for a couple of days and thereafter it just goes off. Key points in relation to the experience of illness. Why are we talking about illness here? Because most of our illnesses have an effect on psychological effect. In fact, I have heard some of the doctors and clinicians saying that almost 95% of diseases, we call them psychosomatic. Psycho means psychological, somatic means body. They are interrelated. More than 95%. When our body is affected and we are unable to cure that particular illness of our body, automatically our mind gets affected, because mind also stays there in the body. It gets affected. So any illness for few days, it may not have that effect on our mind. It doesn't become psychological distress. But if it continues, yes, it does become a psychological distress, because our mind gets affected adversely continuously. Any life stressor leads to physical consequences that can be prolonged. Prolonged illness can bring you psychological distress. Unexplained symptoms are common, but their perceived significance and experience severity varies between individuals, and even if the apparent causes are similar. An important factor that can influence how a person copes with an illness is how they perceive the illness. That depends on your mental strength. If you trust on yourself, you think that you are capable of overcoming this particular problem, maybe psychologically you may not be distressed so much as another person who is weak mentally will feel about it. Insight into and effective coping responses for ill health are using adaptive mechanisms that can be learned. Constitutional and developmental factors influence how we experience symptoms. Development factors, that is where the parents come into. In grooming stage of children, we have to teach our children, you say life is not easy, my dear friends. Here at home we are there, parents are there. Whatever you say, if possible we just fulfill your demands, your food or your education, your clothes and other things. But this is not going to happen when you are adult and we are not here in this world. Life is like this. Prepare yourself for the tough situation which are going to challenge you in the future. From the very beginning, you have to mentally toughen our children. That grooming stage itself, that is called developmental factors. If a child is meek, soft, fearful, then naturally he will have lots of psychological problems. Even if a small challenge comes up in his life, he will be afraid of it to tackle it. Factors that contribute to an individual's psychological experience of illness: genetic, constitutional, developmental, we just discussed about it. Again it comes up here, how the child has been reared up in home. Grooming, significant life events. What has happened when you are a child? See, life events means so many things happen. Someone very close by, very loved one in the family dies. Your whole home gets burned. Your houses, they get destroyed in the earthquake. Your father loses the job. So many things. These are the significant life events, and they are not good events. So they affect your psyche during the developmental stage. Developmental stage at which life events occur. Belief about illness. Some people, they are afraid, they have fallen sick. Oh my God, I have fallen sick. Oh, it's normal. You have a bike or you have a four-wheeler car. A puncture is going to take place. What is the problem? You make use of the stepney, change the tire. Is it a matter of so much of shock and thinking about, talking about? Body is also like this. Body is not going to work. By the way, our heart is a machine which works all throughout from birth till we live. Maybe so many years, 50, 60, 70, 80, doesn't stop, and when it stops we are no more. But yes, hands and other organs, sometimes some trouble will be there. You might feel sick, some fever, some cough, running nose. So these things, no, don't worry. Have that capability to face this. Don't talk about it. Try, restore your health yourself. If not possible, meet some clinicians, go to the doctor. Cultural and societal environment, availability of significant others for support and confiding. Significant others, that denotes your wife, your friends, your siblings, brothers, sisters, anybody, all these people, when they come into your life and you really love them. Therefore, I always say, my dear friends, the family people, they are meant for love and not for fighting. If you create love and friendship all around, you will never have psychological distress, and at all if you have, then there are so many people to support you. Socio-economic factor, society, money, finances are bad. Why should we address mental health so important? Health is a state of complete physical, mental and social well-being and not merely the absence of disease of infirmity. Who is saying this? WHO, who means World Health Organization. Or my friends, we in India, what we are talking about health is swasth. In Sanskrit we call it swasth. Swa means myself. Ast means I have to stand in that myself, When I am fine, I have got full swasth. Nirogi means rog nahi hai, that is called nirogi. Diseaseless means he doesn't have a disease. We, since so many time immemorial, we say swasth and we do not say health. And when swasth refers is physical, mental and social well-being. All the factors, if you got positive factors, then you can say, oh, my swasth is good. My swasth is good. Mentally I am fine, physically I am bloody strong, socially I got lots of support from my family, friends. I love them, they love me. This is what is required. WHO is just teaching us. There are a number of things, they have been changing the definition, but our definition of health remains the same. Swasth, when we say swasth, physical, mental and social well-being, that is called swasth. Let's see type of psychological distress, what we say, anxiety disorder. We worry so much, we are totally uncertain about the future, what is going to happen. PTSD, post-traumatic stress disorder, depression, bipolar disorder and schizophrenia. Causes of psychological distress, traumatic experiences, major life transition. This is what happens. What are the major life transition? From a child you become adolescent. From adolescent you become young. When you are young, no problem. But when you get married, again there are two people, wife and husband, they have to look after each other. So these are called major transition in our life. And nobody has taught us how to complete this transition positively. It has to come up on its own by seeing, observing here or there, but we are not. So when major transition takes place and then thereafter so many unexpected events takes place, you are happily married and all of a sudden someone dies, wife or husband. You are happily married and something happens, some discord in the family and a divorce takes place, children dies, So all these things, they are major disaster in our home and a lot of stress comes naturally. I mean, in such situation, anybody gets a shock. Anybody gets a shock. But if you are mentally strong, then within few days you can rebound. You can regain your strength, fight it out and you can start leading a normal life again. Cancer and other medical illnesses, divorce, starting a new job. New job means new boss. What is he going to do? What is he going to ask for me? Will it be a 8 hours job or 10 hours job? New job is far away from your own home. Earlier job was just nearby. You start your vehicle and within 10 minutes you are at the place of location of job, but now it is 50 kilometers away, So all those things when you start a new job. Victim of bullying, you are a meek personality, so people always push you. Adverse school experience, adverse work experience, infertility, you do not have any issue, and mental illness, mentally you are sick. What are the symptoms? Symptoms and causes. symptoms of mental distress include a wide range of physical to mental condition, both type of symptoms, physical as well as mental. Physical symptoms may include sleep disturbance, anorexia, that is a lack of appetite, you do not feel hungry at all, loss of menstruation for women, headaches, chronic pain and fatigue. And mental condition may include difficulty in anger management, compulsive obsessive behavior, a significant change in social behavior, a diminished sexual desire and mood swings up and down. Other symptoms: weight gain, anger management problems, obsessive thoughts, physical symptoms not explained by a medical condition, decreased pleasure in sexual activities, hallucinations, अलग अलग तरह की भ्रांति होती रहती है प्रतिदिन, delusions, reckless acts, that is excessive shopping sprees. Sometimes you feel like shopping. Even economically you are not strong, but still you spend your money, and then you bring about economical disaster in your families. Believe that others can hear your thoughts, believe that there are so many beliefs, unnecessary you are thinking that other people are listening your thoughts and they behave abnormally with you, strange or unusual behavior, wearing your clothing backwards, this or that, there are so many psychological distress. There are certain indicators for potential for psychopathology. What category of people may fall into this line of psychological distress, psychopathology? The people who do not express their emotions, they are not open about their feelings, they keep everything within. So naturally, if you keep things within, what will happen? If that whistle in a cooker doesn't work, what will happen? When the pressure of the vapor builds in, it cannot go out through that whistle, it will burst the whole bloody vessel. This is what happens. After all, the tongue has been given basically so that you express your emotions, you be open, that pressure will come out and you feel relaxed. Low self-esteem, you have to build your own self-esteem. After all, you are the wonderful creature of this God and everybody is, you are one of them. Have trust on you, self-confidence. History of recurrent traumatic life events, this happens, this is not in our control. Sometimes certain things do happen in our life. Every couple of years something happens in our life, somebody dies or you lose your job or home gets burnt, But then one has to, after all, we have come here in this life and such things will happen. Take it in correct spirit. History of childhood, adverse life circumstances and previous history of functional problems and unexplained symptoms. So these are the potential such people can fall to this. Health, belief and explanation that are very disease oriented or externally controlled. It is the back, it is gone again. Last time they said it, they start believing in everything, whatever is possible. No explanation will do anything to them. Dissatisfaction will attempt to share decision making and to encourage self-help, which may appear to undermine the patient's perceived need for professional care and referral. Recently, this 2010 onwards, a positive psychology movement had started. Positive means positive, and this generally talk about psychological well-being. Psychological well-being is about lives going well. We must enjoy our life. It's the combination of feeling good and functioning effectively. You must feel good every time in any circumstances. And in the given circumstances, if you do your work 100%, you feel happy. How do you work 100%? Again, the principle of Gita, what Krishna said, Karmanevadhikarastu ma phaleshu kadachana. You have got rights on the work, what type of work you will do. But forget about the results, give it in the hands of Lord. If you have done well, something will turn out well, and whatever comes out, just accept it as it is. By definition, therefore, people with high PW report feeling happy, capable, well supported, satisfied with life. PW, that is psychological well-being, that factor. By definition, there are people by birth, they remain happy. You must have seen people, there are so many people in their life, they always smile. You also must have seen your friends or others, So such people, that factor of well-beingness is very high, and they feel happy, they feel capable, well supported, satisfied. Consequences of such PW to include better physical health, mediated possibly by brain activation patterns, neurochemical effects and genetic factors. So this is what we should try and follow, psychological well-being, and it's a weapon to fight against psychological distress. Last, my dear friends, psychological problems will come up. There is nobody in this world who doesn't have a psychological problem. It's a simple, don't worry about this term psychological. When you feel unhappy, you have got a problem, and doctors will call it a psychological problem. So such problems will come in your life. Sometimes they are very big, and sometimes they are very small. Sometimes they go away in few days, and certain times they remain with months together. In such situation, we call it psychological distress. People, mental health experts, they call it mental distress, whatever it may be. I just tell you, my dear friend, social support is the answer. That's the key. Remain activated, have enough social support, do some service to the people, believe in your family, look after and respect your parents, look after and respect your children, friends and everyone. This is the social support, and things will come and go, and you will remain happy forever. Thank you.